When I had 2 of my wisdom teeth taken out, the oral surgeon said to me that he finds women to be better patients because they can tolerate pain better, and he was a man. Well, Georgia Whitkin, I don't know what the answer is to your workshop, but that was the answer of my oral surgeon.
And we're going to find out. I personally love the idea that men always keep their appointments. However, women do the talking when they get into my office, and men seem to get healed just by coming in. So we're going to find out what today's workshop's guests have to say about that. They are all doctors, and come meet them. First, we have Dr. Louis Galley. He is a podiatrist.
Women are definitely the better patient.
Love to hear that. Doc
In some areas, men in other areas.
Oh, and we'll find out which areas. Do you mean physical areas or no? Okay. Dr. Helen Colen, who is a plastic surgeon.
I think men are better patients.
Good.
Any day.
So you agree in half with me. And Dr. Jean Furuyama, and she is a dentist.
Right.
And what happens in the dental office?
The women come in, but the men don't complain.
I see. Okay, sounds a lot like the shrink's office. Well, let's start with Claire's question. When it comes to pain, who's...
Question about it.
No question about it.
No question.
Let's hear.
Okay. Women are much better patients in that regard. Men are babies. Patients that faint on you, basically, are the men.
Always.
You've had men faint.
Oh, majority, I would say I can't remember a woman passing out on me. The men,
It's sort of, men, you know, you are operating on them and you look under the sheet and they're out.
They're out.
They're out.
And
But
they're
that's
not just
wonderful
resting.
because they're out and you can do whatever.
that doesn't have to be pain. The perception of pain that something may cause pain is enough to send a man over the hill. And
I think
Does that
also-
happen in the dental chair?
Definitely, and I think there's a reason why women have babies. The
absolutely.
men could never have made it.
That's true.
So when a woman says to a man, stop complaining, you don't know what real pain is.
That's right.
She really knows what she's talking about.
That's right.
I always suspected so. When it comes to feet, is it the same?
I think it's probably pretty similar, except I prescribe more pain medication for men than for women. Women seem to tolerate. I treat a lot of athletes, and I've had a woman came in who's on a Broadway show with a displaced fracture that she performed on for 3 days.
Really?
I can guarantee you that the same man would have been in as soon as it happened.
How do you like that? We have consensus between the women and the men here that women tolerate pain better.
Absolutely.
Okay,
But
how
I think
about
women do something about pain more. That
That's interesting.
even though they may tolerate the pain more, they are the ones who come in and they will go to the dentist. The men will not come until it hurts.
Now, do you think that's because women are less afraid of the doctor than each other? You never see 2 men keeping each other company in a doctor's office.
No, I think just women are more health conscious, period.
Well, I think that men usually still are the ones who work all the time, so their scheduling is not as permissive as women. And women are always doing the maintenance in the house and the maintenance on their children, so women, therefore, are seen in the doctor's office much more.
Yeah, unfortunately, statistics also say that men tend to ignore problems longer because they don't want to admit that they're ill. They just say they're tired or they're afraid of lifestyle change. So do you find that they wait too long?
I would agree with that.
Yeah.
In my specialty, unfortunately, the shoe gear is what brings the person in. So the women's shoe styles are a lot different than men's shoe styles, so I tend to see more women from that standpoint.
Well, in my practice too, you know, since I do a lot of cosmetic surgery, the men would come only if they are in a sales type position that they have to look better for their job, anything better, and they have more time and they want to look better and feel better, so they'll come in much more often.
It brings another aspect of differences between men and women as far as being critical. Women are much more critical of the results following surgery than
So
men.
it's not just before. Critical of you?
No, critical of what you've done.
Okay, that's what
basically.
I mean.
So a man, if you have a gentleman with a twisted nose, which is on the side of his face, he just wants it somewhere in the middle, and he's not too upset.
character.
He's not too upset if it's a millimeter difference. But if you have a woman and you operate on her, she'll more times than not come in with a ruler afterwards and tell you the difference. I have a, for instance, I did a rhinoplasty a number of months ago.
That's a nose job.
Nose job, excuse
Right,
me.
okay.
A number of months ago, and this person had a fantastic result. She was happy. It's the type of result that you'd like to put on your wall before and after. And she was happy. Her husband was happy. She sent in patients. She came in the office 2 months later. She said, everything is great, but. Always that but. And I said, what's the but? And she takes a picture out and shows me a view where her husband took looking up from below through her nostrils, saying that there was a slight asymmetry of about 2 millimeters. And we measured that, and it was true. And I took the pre-ops beforehand. There was about an 8 millimeter difference, and I said, well, you can see the difference, and who is going to look from you below up?
She is.
Oh, well, she looked at that and she said, well, I guess you're right, and never said anything again. But you'd never find that with a
But
man.
you see, that brings us back. Who is the better patient? So,
Yes.
Again, if you have a woman, she'll ask you many more questions before. She'll visit your office 2 or 3 times before she makes a decision. Am I going to have a wrinkle here? Is the wrinkle going to move? Is it going to still come back? How soon? You have
could
a
call that
man-
homework. She does her
right.
homework.
A man would come in and says, look, I got off in 1 month. Put me on. I want to get it done. How long am I out of work? And that's it. And that's very nice.
So they want to know about business.
Right.
That's it.
I would disagree a little bit. Just from a cosmetic standpoint, the women are definitely more critical. From a functional standpoint, I'm dealing with mostly athletes, maybe because there's more weight involved. The men are more critical as to the amount of function that they need to get back
So
to
let me see
either
if I
running or
translate that.
jogging.
Men wanted to work,
Men
and women wanted to look
That's
good.
correct.
I'll go along with that, too.
That's good.
I think
When
that's
you-
true too. I think in dentistry that's very true. That women, and although we're going for veneers and cosmetic dentistry, that women are more critical afterwards. Oh, this, and it's true.
How about during? Now, everybody has some fear of dentistry. We hate to make you the bad guy, but
I have tremendous fear of dentistry.
Oh, we're not so bad these days.
I don't know.
now you're both women. When you have men come in, do you treat them differently than you treat women?
Yes, I do, because to a woman, I relate as a woman very often. We would discuss, well, if you want a breast size, what looks good for your body, and so on. With a man, you can't really, you know, it's sort of like when you go shopping with another woman. Does my dress look better or not? It's easier. With a man, you have to be more clinical. Okay, this is what we can do. This is what's going to be. You don't really get into of that discussion that women get into when they talk to each other.
Yeah.
So you do naturally treat them different.
That's true to some extent.
Yeah. Is that true of men, too, that you treat men buddy to buddy the way women are treating?
I think maybe that might be true. I mean, I tend to like women more than I like men, so maybe I spend a little more time with a woman. But I think that's true. You can be more one of the guys and you're relating how something's going to work. To a woman, it's a little bit different.
But that's very
exactly
honest. Go
right.
ahead.
You see, women relate to women as women relate to women, and women relate to men, whether you are a physician or whether you are a salesperson or whether you're a lawyer.
But there are
It's
a lot of
different
women
thing.
who prefer, believe it or not, to go to men. They're used to father figures. They assume that men know more, that men will treat them in a way that's more hand-holding. Do you find there are some women who literally prefer that you act like father?
I would say yes, that's true, but I also would say that, getting back to your previous question, that form and function, men want to look better, but they also want to breathe better, getting back to a rhinoplasty, whereas a woman is really concerned about looking better. She'd like to breathe better as well, but she's not going to give you any complaints about that. So you have to take that into account when you operate on a man.
You know, when you ask about women preferring going to a man, in certain respects, I think for general surgery, they think the man maybe is a better surgeon because he's a man. But when it comes to aesthetics, especially body aesthetics, very often a woman will come in and say, you know, I want to go to a woman because you'll understand why I'm upset about my breasts or why I look like this and what I would like.
That's
Well,
definitely
you
true.
know, so that's a different story. Maybe if they go for facial surgery or head neck surgery, they might prefer going to a man.
Well, let's take a non-cosmetic area. You have a man walking into your office, and there's a woman dentist. How does he react?
It depends. Most is very, very positive. They think that a woman's going to be more gentle, more understanding. And women, also, as you're saying, the woman feels that a woman's going to understand. She's going to understand color, she's going to understand form, she's going to understand aesthetics. Whereas men want to get the job done.
But is it true?
But they
Are
want
women
it,
done?
they want it done more gently.
And is it true?
No.
How about baby?
But I'm not going to say, I'm not going to, change their minds.
Who's the baby in your chair? The woman or the man?
It's hard to say. Because different aspects.
The man,
I think
no
the men
question
are
about it.
definitely more.
Men are babies.
Yeah.
The men are the babies?
Yeah,
Without a
they
doubt.
move about
I want to hear more about this.
No, they move about more. They're unsure of what's going to happen, even if you tell them beforehand. Well, a woman will really sit there and let you do what you have to do to make her feel better. A man will give you a hard time sometimes.
Well, I had one man I had to offer a lollipop to before he lay down on the table. And I think I'll never forget that because it had to be a red one on top of it. But it was, after that, he was a very good patient, but he was very nervous. And the lollipop helped. Now,
And who do you prefer? Bottom line, who do you prefer as a patient?
During surgery, a woman. Afterwards, a man. So you can't say I prefer this patient, a
No,
man.
but that was a good explanation.
You know,
who do you
in
prefer
total.
in the dental chair?
I like to chat with the women.
You like to chat with the women? Okay, so for personal reasons, you like
Right.
women. Who do you prefer?
I agree with Dr. Colen. During surgery, a woman, no question about it. After surgery, I'd rather she change into a man.
Because?
No, because women
Less
are much more critical, as I said before, and they'll give you a hard time afterwards. Not all women, by any means. But the man is happy with a nice result. A woman will be happy with a result, but she'll give you a little grudge and say, it's a millimeter difference.
I find just the opposite. I think I'd much rather have a woman post-operatively. They follow your instructions better to the T. You tell them to do this, do this, do this. They do it. Most men think, well, maybe I can do it my own way. They have their own opinions, and my best results come out on women.
Yeah, but very often the men have their wives calling. Go ask the doctor what I should do. So they look great, and the wife is the one who looks like she's really a pain in the neck.
Well, I learned
you know.
a lot about women and men. In particular, it sounds like some of the stereotypes are true. Women are better with pain, and men are more babies. So I want to thank all of the doctors for coming.